Hello, dear friends. Today's talk is about the latest trends in hormone replacement therapy in men, and more precisely, testosterone replacement therapy. Every man has a 1 to 2% drop in blood testosterone levels after the age of 40, and this continues into old age. The fall in testosterone levels can cause impaired libido, erectile dysfunction, decreased muscle, and increased subcutaneous fat. It also causes a decrease in bone mineralization, that is, osteoporosis, impairment of the immune system, mental ability, behavior, and enjoyment of life. In short, many of the troubles associated with old age happen to a man after 40. And, of course, the idea was born that if all these conditions are related to testosterone deficiency, then it can be corrected by applying testosterone from outside. Indeed, now this tendency to prescribe testosterone replacement therapy to men is widespread. It's getting to the point where not only doctors, but also men are prescribing testosterone injections or any other drugs for themselves. In addition, it comes to radical statements that every man after 40 years of age should take hormone replacement therapy. But how justified is this? Let's talk a little bit about the physiology of testosterone. Testosterone is produced in the testicles by Leydig cells under the influence of luteinizing hormone. Luteinizing hormone is produced by the pituitary gland. The pituitary gland also produces follicle-stimulating hormone, which has more of an effect on sperm development. If a man's testosterone production in the testicles drops, this is called hypogonadism, primary hypogonadism. If the production of luteinizing hormone in the pituitary gland or follicle-stimulating hormone is impaired, this is called secondary hypogonadism. But when both of these disorders are present, it is called mixed hypogonadism. To establish a diagnosis of hypogonadism, do not apply to all men in a row a routine test of testosterone levels and its various components, serum levels. This is unjustified. In fact, one should not look at testosterone levels, but at a man's symptoms. The point is that testosterone levels in the blood do not always accurately reflect the processes occurring in the organs. Testosterone can be free and bound. It can also be high in concentration, but the tissues may lack an enzyme called 5-alpha reductase. This enzyme converts testosterone into the active form. So, if a man has a high amount of testosterone and a low amount of 5-alpha reductase, then all testosterone effects will be offset, and the man will feel as if he has a testosterone deficiency. Therefore, in clinical practice, in civilized countries, a man is not initially tested by blood tests for the presence of testosterone and its amount. By the way, these same tests are not always accurate because all values were worked out on healthy young men. Therefore, according to the table of reference values, you will see great variations by age and significant variations in the upper and lower norms. It is because these norms are not yet well understood. That is why they prefer to start with questionnaires. The most frequently used questionnaire is called ADAM, which stands for Androgen Deficiency in Aging Men. By completing this questionnaire, we can tell if a man has symptoms of testosterone deficiency or not. I will give you the link to this questionnaire in the description below the video. It is in English, but you can use Google Translate to fill out this questionnaire. I tried to find a Russian language version, but I couldn't find it. If the questionnaire shows a suspicion of testosterone deficiency, you should get tested. I have also made a separate video to check for testosterone deficiency and related indicators. You can see the link in the description. Testosterone deficiency tests need to be done twice. One test cannot tell anything because there are too many factors that can affect testosterone fluctuations. If two tests coincide and show low testosterone, then hormone replacement therapy is prescribed. This is the only and exclusive indication for the use of testosterone preparations in medical practice. The temptation to use testosterone preparations based on the fact that a man is over 40 years old or has some symptoms that can be associated with testosterone deficiency is not justified. That is, you have to figure out where the legs are coming from first. The fact is that many symptoms similar to testosterone deficiency can occur due to other health conditions, overtraining, stress, thyroid dysfunction, and so on. In other words, It just needs to be well understood. For substitution therapy, in case of testosterone deficiency, prolonged testosterone preparations are used, such as, for example, Omnadron 250 or Nebido, which can be injected every 3 months. Also, luteinizing hormone preparations or estrogen receptor modulators such as Clomid, clostilbigite, aka clomiphene citrate, can be used. Also, aromatase enzyme inhibitors may be used. Aromatase is an enzyme that converts testosterone into estradiol, that is, for example, letrozole or anastrozole. All these drugs should never be taken on their own or prescribed by yourself. It is always necessary to consult a doctor. They have numerous contraindications and side effects, which I will tell you later. But what about the facts? Does hormone replacement therapy in men who are not testosterone deficient cause such dramatic changes in their lives that people are increasingly turning to these drugs? In one of the systematized reviews that looked at 47 studies on hormone replacement therapy, the results were as follows. In 24 studies, people did not get satisfaction from the use of hormone replacement therapy. In 23 cases, the results were satisfactory, and people got some pleasure, improved quality of life, also sexual activity. That is, the use of testosterone in large, statistically significant studies is very controversial. It is interesting that in those groups where the use of testosterone for sexual enhancement had a positive result, people were not taking testosterone but phosphodiesterase inhibitor drugs, such as Viagra and related pills. These subjects taking Viagra, let's call them that, were more satisfied than people who increased their testosterone levels. Thus, the use of testosterone has mixed results, and looking ahead, if we weigh the side effects of testosterone against the side effects of Viagra-like drugs, such as phosphodiesterase inhibitors, then, of course, testosterone is far superior to the notorious Viagra in terms of side effects. Regarding osteoporosis, studies have also been done. Studies have confirmed that testosterone does increase bone density, but despite this, associations that deal with the treatment of osteoporosis do not recommend the use of testosterone, as it has some side effects that outweigh its positive quality. About glucose, the effect of testosterone has also been investigated. It has been found that testosterone as a replacement therapy can lower blood glucose and improve insulin sensitivity. But again, diabetic associations also do not recommend the use of testosterone as a therapeutic agent for diabetes. Testosterone has shown perfect results when used in cases of depression or cognitive impairment. But again, the results were obtained on small groups of people and cannot be called statistically correct. Now, about possible side effects, substitutes for hormone therapy in those men who are not deficient in testosterone. Firstly, the incidence of cardiovascular diseases, not only heart attacks but also strokes, increases significantly. It's so severe that in 2014, the American Food and Drug Administration even issued a call to stop uncontrolled prescription of testosterone to improve people's quality of life. In addition, excess testosterone can cause prostate gland growth, triggering prostate adenoma. It can also cause or enhance the development of cancerous processes in the prostate gland. It can cause gynecomastia, that is, enlargement of the mammary glands in men, as well as breast cancer. The point is that, as I've already mentioned, high concentrations of testosterone can be converted in our body into estradiol, that is, into the female sex hormone, which has the opposite effect. That is because there is such an enzyme aromatase, and aromatase activity varies from person to person. We cannot predict when a person starts using testosterone whether he will have this effect of estrogen accumulation or not. It can only be looked at de facto. Some of the non-dangerous but unpleasant side effects of testosterone include the appearance of acne, that is, acne on the skin, and baldness. Another side effect that everyone is aware of is the suppression of the body's own production of testosterone. Prolonged use of testosterone causes the body to learn how to produce it. The hormones responsible for its regulation, that is, luteinizing and follicle-stimulating hormone, drop to zero, and then it's hard to get it all back. Thus, we can conclude that the use of testosterone is justified only when there are clear medical indications. But in cases when you want to make your life better, have more sexual energy, look more beautiful, build muscle, and so on, you should not turn to testosterone preparations. It's too dangerous. It's better to look for more environmentally friendly ways to achieve your goals. For example, to increase testosterone naturally is training, adequate sleep, lack of stress, normal nutrition, and vitamins. That's all for today. In a future video, I will try to reveal how you can increase testosterone naturally. Always for you, Dr. PopMed.